Dear parents, topic for today is fever in your child. What can you do about it and what are the danger signs for which you might have to meet your doctor? Now, let's try to understand what actually a fever means. A fever is a natural response of the body to fight an infection or an inflammation. It indicates that your immune system is working well and it is working overtime to help you tide over this crisis. Let's understand that a fever can be caused by a variety of reasons. Particularly common things are infections by viruses and bacteria. A kid usually catches more infections than adult. Why is this so? Kids commonly put things in their mouth. Also understand that the kid has a lower immunity compared to the adult as it is gradually improving. Kids also receive vaccination which can also cause some fever. Occasionally, fever can be associated with exertion. We also understand that kids go to play schools, they meet a lot of other kids and these infections are transferred from other kids. So, there are a variety of reasons for the child to get a fever. Now, having understood why a child gets fever, let's try to understand what all constitutes a fever episode. Let's understand that many parents come to us telling that the child has a headache, the child has abdomen pain, leg pain, and numerous symptoms. But these are all just parts or presentations of fever. We have to understand that fever can be associated with headache, body ache, the child might appear tired or he might be sleepy. Parents might also notice a rise in the heart rate or respiratory rate. Occasionally, the child might startle or they might have chills. Very rarely, they can also have something called as a febrile seizure. During a febrile seizure attack, the child might have uprolling of eyes, tonic-clonic movements of the body, extensor posturing, and frothing. Please understand that febrile seizure is a very rare occurrence, usually associated with high fever. Rarely it causes a life-threatening event, so there is very rare association of any brain damage. So rest assured that most of the kids with fever can have all the symptoms, very rarely a seizure, which is rarely or almost never associated with any major consequences in the form of brain damage or life-threatening event. Having understood this, let's try to understand what are the danger signs or red flags for which you have to consult your doctor. If the child has a temperature of above 102 degrees Celsius, it can be slightly dangerous. If the fever continues despite giving antipyretics for a duration of more than 3 days, it could be a point to worry. Let's understand this very clearly. If your child is active and playful once the fever comes down and he is only lethargic at the height of fever, this usually is a reassuring sign. But if the child is lethargic or not active even when the fever comes down, it is a point of concern. You have to meet your doctor. If it is associated with startling spells or seizures, definitely you meet your doctor. But some conditions which might make you feel to go to the doctor, like decreased urine output, a very irritable child, a child who is not taking anything orally, may all be some concerns which might be presented to a doctor. I also advise that most of our mothers have a very good instinct. If they feel that the child is not well and there is something different from the previous episodes, please definitely take him to a doctor. So these are some things which you have to keep in mind during the child having a fever episode. Now, a very interesting thing, that is, what all things you have to prepare when you go to the doctor. Invariably, these questions will be asked to you. So, beforehand, be mentally prepared for this. Like, how long has the fever been? Or, how frequently he is getting the fever? Is it 6th hourly, 4th hourly, 8th hourly? Or, how high was the temperature? For which you have to record the temperature. Was it 101? Was it 104? Also, I have mentioned the danger signs earlier. So, be prepared to answer the danger signs. Also, they might ask how is his activity during the time when he is not febrile, and make a note about his urine output. I would also advise that before you go to the doctor, you make a cursory check on your child. Undress your child and check him from head to toe. Make sure that he doesn't have any rashes on his body. There are no abscesses or follicles or pus discharges, especially in hidden areas like the perineum, behind the ears, in the nose, in the ear, or in the oral cavity. Please do a check of the oral cavity. See if his throat is red, he is having difficulty to swallow, or his tonsils are enlarged. Also make sure that you have a look at least once on how the child is passing his urine. Is there a change in color, or is there any burning sensation when the child passes his urine? So these are some of the things which you can look before you go to a doctor, so that you can inform him well and the doctor can prescribe you right medications. Now, coming to the 10 important advices for parents whenever the child is getting a fever. First thing is, whenever the child is having a fever, you have to note it. That is, please learn how to use a thermometer. Whenever the child is having fever, you have to check his temperature at least twice. Please understand that most kids, when they come to hospital telling that the child is febrile, invariably the child is running very less or no temperature. Especially in teething children, when there is slight increase in body temperature, parents feel that the child is continuing to have fever. But it is only a fever if the temperature is beyond 98.6 degrees Celsius. I also tell that if the child is active, he is playful, not cranky, feeding well, then even a temperature of 98.6 is not of concern. If a temperature is beyond 104 or 38 degrees Celsius, it is definitely wrong. But in the below that, if he is very active, you can still ignore it. Second important point would be regarding usage of medications. Please understand that the best drug for you is paracetamol and paracetamol. The right dose is 15 mg per kg. Please prefer, for home use, you can buy the bottles which have the dosing mentioned as per weight on the bottle itself. If your child is between 15 to 17 kgs, 250 mg paracetamol 5 ml is the right dose. If your child is between 8 to 10 kgs, 125 mg paracetamol 5 ml is the right dose. In the same way, you can titrate and use the right dosage. If it is difficult for you to calculate, you can speak to your doctor and identify the right dose. Prescribing the right dose is very important, because a lower dose will not take care of the temperature and higher dose can have deleterious effects. Please understand, you can use this medication once every 4 to 6 hourly. Using it before that is not going to be of any help. So what do we do if the fever does not come down despite using paracetamol? That comes to our third point, that is, you can use a washcloth or tepid sponging or wet mopping, that is with lukewarm water. Please understand, when the surface is boiling, a cold or warm water, any of it will eventually evaporate. This phenomena of evaporation is going to relieve the temperature of the child. So, using lukewarm water is ideal, because if cold water is used, this can sometimes induce what is called as chills or shivering in your child. So, use lukewarm water. Keep frequently mopping the child's body. Undress him and mop his forehead, his back, his chest, and all the arms and legs. This is very important, because if fever is not controlled with the medications, then this comes to your rescue. Now, after having done this, what you can do is, if it continues beyond this, you can meet your doctor, or you might have to use additional drugs. So these are the main steps. Now coming to, what about the dietary or food habits in your child? Please understand that during this time, light food, frequent small quantity meals is advised. Please avoid oily and spicy foods. Let him have a bland diet. If your child is not eating for a day or two, it is not very dangerous. But coming to our fifth point, that is hydration is extremely essential in your kids. The child has to frequently drink small sips of water. You can also give fresh fruit juices, tender coconut water, buttermilk during these episodes. Having understood the diet, we have to make sure that during these episodes, the child gets adequate rest. Rest is essential seventh step in managing your fever. Please understand, the body is exhausted. Good rest will reinvigorate your child, and he'll feel more fresh once he gets up from good rest. During these episodes, parents feel whether we should give bath to our child. Please understand that bathing will essentially relieve him of his stress, and it will make him feel more fresh. So bathing is allowed unless the child is very sick. Please avoid bathing at the height of fever. Avoid using very hot water, and lukewarm water baths. Brief baths are advised. We have invariably seen that parents dress the child heavily, use very warm blankets while the child has fever. Please make sure that let him feel fresh. Make him wear thin cotton clothes, and let's not make him sweat excessively. This will make him more comfortable. And the last part would be, as I explained the danger signs, please make note of these danger signs, and if any of them are present, you have to meet your doctor. So I hope this was informative, and most of the questions which are pertaining to what will happen during the fever episodes are answered. Thank you.